Hey, how's it going, everyone? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 18 of my multi-part video series providing a broad overview of the discipline of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. Today I'd like to open up by talking about foreign body aspirations. I'll be discussing the bronchopulmonary segments in the upcoming slides. So foreign body aspiration, it mainly involves the inhalation of foreign bodies like pins, dental fragments, screws, nuts, bolts, toys into the lower respiratory tract. This frequently occurs in children, and it is more prone to occur in the right primary bronchus, which leads to passage into the middle or lower lobe bronchi. In a vertical body position, the foreign body typically descends into the posterior basal segment of the right inferior lobe. Let's go ahead and take a look at the bronchopulmonary segments now. So I'd like to start off talking about the bronchopulmonary segments of the right lung. The right lung has 10 bronchopulmonary segments. In the superior lobe, also known as the upper lobe, we have the apical segment, the anterior segment, and the posterior segment. In the middle lobe, we have the lateral segment, the medial segment. In the inferior lobe, we have the superior segment, the anterior basal segment, the posterior basal segment, the lateral basal segment, and the medial basal segment. And all of these segments can be seen on the picture to the right, depicting the right lung. Let's go ahead and move on and talk about the bronchopulmonary segments of the left lung. So the left lung has 9 bronchopulmonary segments. In the superior lobe, we have the apico-posterior segment, the anterior segment, the superior lingular segment, the inferior lingular segment. The superior lobe also is known as the upper lobe, again. And we have the inferior lobe, known as the lower lobe as well. This one is made up of the superior segment, the anterior basal segment, the posterior basal segment, the lateral basal segment, and the medial basal segment. So about 9 segments here, and you can see them all on the picture to the right for reference as well. That should help out a lot for your understanding. So let's go ahead and move on to some questions. Which of the following statements best characterizes the localization of foreign bodies aspirated into the lower respiratory tract? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Foreign bodies aspirated into the lower respiratory tract frequently entered the right primary bronchus due to its straighter and wider anatomical structure compared to the left primary bronchus, which takes a more acute angle off the trachea. Consequently, foreign bodies are more prone to passage into the middle or lower lobe bronchi on the right side. Additionally, in a vertical body position, the foreign body typically descends into the posterior basal segment of the right inferior lobe due to gravitational forces. Therefore, the correct answer is C. Foreign bodies are most likely to enter the right primary bronchus and pass into the middle or lower lobe bronchi. Let's go ahead and see why the other answer choices are incorrect. Foreign bodies are more likely to enter the right primary bronchus rather than the left primary bronchus. The anterior basal segment of the left inferior lobe is not a common site for the lodging of aspirated foreign bodies. Foreign bodies aspirated into the lower respiratory tract typically pass beyond the trachea into the bronchial tree rather than remaining localized in the trachea. Foreign bodies do not primarily enter the middle lobe bronchi. The right primary bronchus is the more common entry point due to its anatomical characteristics. Let's go ahead and move on to the next question. Which of the following statements accurately describes the bronchopulmonary segments of the right lung? Alright, think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The right lung is divided into 10 bronchopulmonary segments, which include the apical, anterior, posterior, lateral, and medial segments of the superior and inferior lobes, as well as the anterior basal, posterior basal, lateral basal, and medial basal segments of the inferior lobe. Therefore, the correct answer is D. There are 10 bronchopulmonary segments in the right lung. Let's go ahead and see why the other answer choices are incorrect. The right lung has more than 5 bronchopulmonary segments. It has 10. Right lung has more than 8 bronchopulmonary segments. It has 10. So those two can't be right. While it's common for the right lung to have more segments than the left, there are not typically 12 segments in the right lung. There are 10. The right lung typically has more than 6 bronchopulmonary segments. Once again, there's 10. A lot of these anatomy NBME questions are really straightforward, so just keep that in mind when answering. It all comes down to the content, you know. Let's go ahead and move on to the next question. Which of the following accurately describes the bronchopulmonary segments of the left lung? Alright, pretty first order question. Think I gave you guys more than enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The left lung is divided into 9 bronchopulmonary segments, which include the apico-posterior, anterior, superior lingular, inferior lingular, superior anterior basal, posterior basal, lateral basal, and medial basal segments. Understanding the anatomical divisions of the left lung is essential for clinical assessment and surgical interventions. Therefore, the correct answer is the left lung comprises of 9 bronchopulmonary segments. Let's go ahead and see why the other answer choices are incorrect. Left lung typically has more than 6 bronchopulmonary segments. It has 9. While some variability in segmental anatomy can occur, the left lung does not typically have 10 bronchopulmonary segments. It has 9. There are usually more than 8 bronchopulmonary segments in the left lung. As stated earlier, it has 9. While anatomical variations can exist, the left lung typically does not have 12 bronchopulmonary segments. Remember, The right lung has 10, left lung 9. That's one thing you take from this video. Right lung 10 lobes, left lung 9 lobes. So I hope this helps you guys out for a general anatomy overview. Your test questions won't be as easy as the ones I gave you. I was being really generous today with the questions, but the main concepts you got to get are right lung 10, left lung 9. I really want to stress that, and then make sure you know the first slide as well. So if you can get that down, you should have a lot of the lung anatomy down. So that's all I have for you guys today. If you have any questions, comments, or concerns, please feel free to leave them in the comment section. If you like this type of video, please feel free to leave a like and subscribe for more content like this. And this is FixerMed signing off. Be sure to have a great day, everyone. Goodbye and good luck studying.